Well, a hospital in the Eastern Cape, I'll bring you to that story in a moment. I want to tell you that we're going to go back to Cape Town shortly. Our reporter Lindsay Dentlinger will be standing by with a wrap of what the President has been saying in the last few minutes. But while we wait, let's go to the Eastern Cape because it's had close to 3 critical departments closed at one of its hospitals. That's the Cecilia Makiwane Hospital. Nurses and general staff there are in self-isolation. It's in Danzane, that's the town. Let's get your reaction on the story from Nahao's Eastern Cape Provincial Secretary Miki Chatseni. Miki, a very good afternoon to you. Thank you for being on ENCA. So when we were first reading about what was going on at Cecilia Makiwane, we heard about these 3 departments that were closed. Almost 80 health workers were going to be tested for COVID-19. Have the workers been tested, A? And B, are the units back up and running?
Now, let me first indicate that indeed we can confirm that parts of the Cecilia Makiwane sections have been closed due to the infections that have taken place and our staff members that tested positive had to be quarantined and tested. But we can safely say we are in that process of having them tested, but also be quarantined so that they cannot affect others. So we can say the intensive care unit is closed, does not have patients, and also the OPD. So we are saying there is also this challenge of the PPE that is still ravaging our hospital. So we are also saying there is 1 doctor that has been infected, 6 nurses and 1 security. And as of yesterday, we had about 10 infections of laundry workers. So that is quite a huge number where we are saying we are not winning in flattening the curve of this pandemic. And I think we are beginning to say this is the only program where we need to complement each other, not to compete. And as politicians, administrators, doctors, and unions, we must be able to fight together. But we want to send a warning to those administrators that are not adding value to the flattening of this curve because they do not have the necessary and the requisite skills to can manage this COVID. I think that's where we have a problem, and we're dealing with that situation.
So currently, when you look at the situation in the Eastern Cape, based on numbers released just last night, Miki, your province has 4,936 confirmed COVID-19 infections. 95 people have died already. When those numbers started picking up, the likes of the health minister said that more resources would be sent to the Eastern Cape. Have those resources arrived?
Yes, we have listened to the president when he visited one of the regions in the Eastern Cape, Port Elizabeth. And we were worried to note that he was so convinced that indeed we are upping our game to flatten the curve. But immediately we saw the numbers rising up. And we knew that indeed we were told that the winter time will be adding up on those numbers because that's when this pandemic or the virus is multiplying. But we can safely say even the numbers, as they rise, they affect more the workers and even the deaths that are happening. And we do not know, indeed, that the interventions that are made by the national government, whether they will succeed because they eliminate some of the key stakeholders like ourselves. We don't have a clue as to what kind of measures that they are putting in place and what kind of resources that they are bringing along, so that we can also form part and parcel of this collective that is beginning to have an approach that will work for the province. And we
Miki,
are really appealing that they must consider that.
Miki, sorry to interrupt you there, but just on the interventions, there were the 20 Cuban doctors who arrived in the Eastern Cape last month. Has that made a visible difference?
No, definitely. We want also to re-emphasize our position in accepting and appreciating the arrival of the Cuban doctors because we know that they will do an immense kind of contribution to our province. But indeed, we are also saying there are those that are still sitting at home, not having anything to do as the medical profession is also needed at this time. So they must come along to how we will make it a point that they can learn more from the Cuban doctors, because they are all over the Eastern Cape, and I think they are trying their level best to go to the most difficult areas, especially in the rural areas where these services are needed the most.
Lastly, we've seen complaints, some of it anecdotal, on social media and the like, from medical workers who say they are seeing a rise in emergency admissions as a result of, or possibly linked to, the lifting of the restrictions on the sale of alcohol. Are you seeing the same in the Eastern Cape?
No, we cannot confirm that, but really you can imagine when people have been given an opportunity to live their own in their own social space. Surely they can do as they like, and the possibility that increases can happen. And we have seen indeed that immediately after the lowering of the level, there has been some increase, but there is no scientific evidence as to say whether it is because of the lifting. But we can assume that indeed there is something that has added to that.
All right. Thank you so much for that, Mickey.